Very nice to meet you. I'm Dr. Shin. I'm practicing in just Overland Park area, maybe 5 minutes away. Do you know the Bronx? Okay, my clinic is inside of that building, Pure Import. So if you want to come to check how I do the acupuncture, always welcome. I graduated this school 2009. One thing, I have another students from CCCKC. Hello. I'm always tell them, confidence is very important. Confidence. What is your confidence? Yeah, what is your confidence for your patient? If the new patients came to you, then what are you going to show them? So I'm always tell them, did you learn about report to finding? Report to finding is very important. I'm always doing report to finding, second visit. What I'm going to do, this is my treatment goal, what kind of types of treatment I'm going to do it, and then how many times, how much, and then what kind of exercise, and then what I'm going to do. I'm explain everything, and then how much. We have a package system too. If you have insurance, then what kind of benefits you have. So we're going to do this kind of things, and then patients say yes, then we're going to be a best friend for reasonable time, not more than 2 months. Okay, compliance. Compliance is very important. Yesterday, new patients came in, and she said, you know what, Dr. Shin, my pain was 50% better than before. But she was a little mean. But today she was very nice because her pain is gone, right? So she said, oh, you know what, Dr. Shin, but I need to waiting my paycheck. So, you know what, I went to another chiropractic office and they said, I don't know how they do, but they didn't collect copay, they didn't collect co-insurance, they didn't do anything because they said my insurance is good. So can you do, my insurance is not covered for acupuncture, but can you do another CPT code and cover this acupuncture? That's so nice, right? I said, my lovely patients, I really like to do it, but I have to save my license. That's compliance. I don't know who did it, but if you want to go back to that clinic, he's supposed to be a nice doctor. You can go back. But me, I'm always trying to keep compliance. That's very important. And she said, oh, I see. Okay, I understand. And then she paid cash. So you have to know about standard care of chiropractic. Of course, this is acupuncture club, but standard care of chiropractic is we have to check re-exam every 30, maybe 40 days after first initial visit, all right? So that is very important. But sometimes, realistically, insurance company, they trying to be a little sneaky between me and patients. When patients talk to them, you know what, I didn't pay any re-exam fee to another chiropractor before, but Dr. Shin said, she said, I need to pay my re-exam fee to him, right? So this is not fair. And then they talk to insurance company, and insurance company tell her, we recommend, but it's not required. But if something happened, audit, right? Audit is very important. They're gonna say, what is your proof? What is your assessment? What is your re-exam? What is your note? You told her this is recommendation, not requirement. Then insurance company gonna say, no, you against to the regulations, so we're not gonna give any insurance patients to you, right? So that's kind of a little sneaky thing. Nobody tells you, but just please keep the compliance what you can, all right? Thank you. And then let's go back.
My question was the difference between...
Yes, dry needle. Thank you. Acupuncture, many patients, they always ask me, Dr. Shin, how it works. Okay, so acupuncture needle is very helpful itself for pain management. When acupuncturists go into the pain area, we call that as ashi point. Ashi point is when I do the needle in my pain area, we're going to, ouch! That's why we call ashi point, right? So ashi point help. Even though, Jack, you do acupuncture on your pain area, maybe upper back, it's going to be help because acupuncture trying to bring all immune system to exopathogenic things. So acupuncture is exopathogenic things. Our immune system always trying to protect our body. So some things go in, then our immune system, lymphocyte, neutrophil, that kind of immune system will come in this area, and then they were trying to find out, heal. That is blood circulation. And then dry needling. Dry needling I just mentioned that that's a little micro types of knife needle. So go deep inside and then they cut. That's very dangerous. But we can do it because we are doctor, right? So acupuncture and dry needling is the same. But PT people, they're trying to do low V. We are PT. We are doctor of PT, right? I like PT people. They're working hard. Why not? So, but my opinion is chiropractor. I'm a chiropractor too. So why not chiropractor can do more advanced acupuncture treatment for our patients, right? This is Midwest. We can do. So Missouri, Kansas, chiropractor can go 100 hours seminar, 200 hours seminars, and then they can do acupuncture. But not in California, not in Georgia. Acupuncture, you have to know the theory. I strongly recommend you can go to Google, check five element theory. You know, did you ever watch the animation from Disney? Frozen, is it Frozen, right? They had water, fire, wood, right? Those story came from Oriental medicine. Me, I didn't bring my book, but I'm always, before I trying to do diagnosis, I'm always to diagnose for Oriental medicine types. I look at their tongue, I'm look at their pulse, and I'm look at their common carotid artery. I'm compare and I check their birth year, and I always check their body types first. Someone say, you know what, this is really great herbal medicine or multivitamin. This one fixed my knee pain, so everybody has to take, everybody needs to buy this one, right? And I bought it. Is it help? I don't think so. Maybe this is good for her because my body types and their body types is different. So we have to figure out their body types first. So I have a lot of friends, chiropractor, who's working in the U.S. So last week, my buddy, my friends call me TJ. TJ, he's in Alabama. TJ, I have right side migraine headache patients came in. What is acupuncture point? I talked to them, you know what? No, this is not the right way to do it. You have to figure out his tongue, you have to figure out his pulse, you have to figure out what was your, objective finding, right, that kind of things. He said, that's too hard. I didn't learn it. I just learned this. Just let me have acupuncture point, right? So I talked to them. No, it's not right. So you have to go. So in here, how many? 1, 2, 3, 4. If you want to come to my clinic, I will show you how I do it. So always, can you do me a favor? Always, we have 2 pulse, right, in here, right? I'm always checking my pulse every day, like this. They call it 총관척. I know, sounds weird. But we always, this is lung, spleen, pericardium, and the other side is heart, liver, kidney. That is yin and yang. This is yin, and yang means small intestine and stomach, and then senjiao, and the other one is large intestine, that kind of yin and yang organs. So you have to figure out what happened. Yang is too much, then always yin is going down. Always fire and water. Fire is always bring up. Water always make it cold. For example, female patients. Dr. Shin, I have a low back pain. And then I couldn't exercise for 3 years because it's so painful. I took epidural shot 3 times every year. And then even though surgery 5 years ago, and then I cannot go to the PT because this is too painful. It hurts, right? So I check her body types, and then pulse and tongue, and then I figure out your kidney function, yin function was really low. And I boost up energy work. Energy means 25 or sedate. Yang channel is too much, we have to bring it down. Yang channel is too low, we have to bring them up, right? Very simple. Oriental medicine is very simple. How you do that? I do acupuncture, go into the specific area, point, and then rotating to the right side 3 times. That is tonification. To the left side 2 times, that is sedation. It's very simple. It's very simple. I know 100 hours is not enough. But if you want to, I'm always welcome to teach you. My hands, every morning when I wake up, I repent. Because I think that is one of my basic things I need to do before I see my patients, because I believe my energy is coming out from my hands. If I think it's too much greedy, too much temptations, too much little sneaky things, patient feel like uncomfortable. Someone do massage therapy here too, right? Same thing. Sometimes we want to do massage therapy, feel great, but sometimes it's not feel good. Why? I don't know, but I believe their energies come out from their hands. So you have to know about yin and yang, 5 elementary theory. It's very easy. Just go to Google and then just reading it, then you're gonna surprise. Very interesting. So many people, they ask me, Dr. Shin, how it works? One, ashi point, right? Stimulation, exopathogenic thing came to my pain area, and then my brain say, hey, go to the troop. So immune system go there and they're trying to fix. And then the other one, meridian techniques. We have 12 organs, systems, right? Systems in our body. So each organs, we have meridian channels from starting point to ending point. When you're trying to do sprinkler, it's not working. One of my sprinklers, what's going to be maybe some little stone, maybe rusting inside. So we have to, what do you call this? Rubbing it, right? So same thing, acupuncture. There are, if you see the five elementary theory, they always say, this is mokha togumsu. That means tree, fire, ground, metal, water. So they have a relationship with each other. They always trying to sedations. Thank you. There we go. That one. Sedation and tonification. So you can learn. You check your pulse every day. You can check. Google has it. So you can check your pulse every day, and then you can try to do acupuncture by yourself. Why not? Is acupuncture points? How many? A lot. But I believe I'm using only maybe less than 30 points. Last week, we had the 2 patients came in, new patients. One, Bell's palsy. One, severe disc herniations. Really, really bad. Really, really bad. Numbness, tingling, sharp, achy pain. He was previous secret agency guy. Very tall, very handsome, right? And then I checked it too, just like Molly, what I did to Molly. And their radiculitis, disc herniation patients, his common carotid artery pulse was really stronger than here. And I put acupuncture, not ashi point, just meridian technique acupuncture. And then I do little special needles for disc herniation. And then he said 40% better, right? Of course, pain can coming back. But I can just teach them, if you have this little tingling, numbness, pain, achy pain again, don't embarrass. You can manage this. That is good point. Me, honestly, I have a disc herniation between C4, C5. I know what that means. I trying to figure out, oh my God, I'm 47 now and I have this. It's really painful. Depression. If you have a pain, you can have a depression, right? But then also if you have any relationship issue, society, a social life issue, financial issue, you can more depression too. So when patients come in to you, then you can treat them, but if you open your mind, then they're going to open more. Patients bring more word of mouth. People keep coming. People say, who's Dr. Shin? Who's Dr. Chin? I said, no, Dr. Chin, I'm Dr. Shin, right? Shin Von. So people, nowadays, Georgia, I was been in New York 7 years, LA 7 years, Georgia 7 years, Kansas City 10 years. They need help, your help.
How many people come in looking straight for acupuncture or just for chiropractic, and then you get them over into acupuncture?
Okay, first of all, I told you like 60% of our new patients is word of mouth. So they come to me and then they said, I will do whatever you say. Okay. And then at the very first visit, I do everything. Okay, welcome to a buffet. My treatment, Dr. Shin's buffet treatment, right? And then you try this. If you like this, I will do this. If you don't, I'm not going to do it. Exercise too. We have a lot of exercise plan, right? We teach our patients 4 exercise, 3 exercise every visit. But I tell them, This is not make sense. You don't have any time to do this or exercise. But this is exercise buffet. You can try this. If you like this, you're going to do this only, not whole things. This is a learning process. So pretty much patients came in after the first visit. Pretty much everybody wants to do acupuncture. Sciatica patients, urology patients, prostate patients, pelvic floor pain patients, sciatic piriformis, acupuncture really happening a lot. This is 120 millimeters, which is that 3 inches, maybe 4 inches, right? When these needles go into the deep inside, hip joint area, they saying it's amazing. But she said, I don't know why another chiropractor did this to her before. I want you to learn, practice yourself. You can buy this little needle from website too. And then practice yourself, and then you can feel it, and then you can do it. Bell's palsy patients too. He came, new patients, and then he was pretty much 65 or 70 years old. Same thing, I check his pulse. His common carotid artery pulse was really weak. And then we did acupuncture, Bell's palsy. And then after 2 days, 2 treatments, he came back and he said, look at my face. And his face was like even. Acupuncture is really help. Really, I can tell you this. This is really help. Adjustment is good too. If you like adjustment, right? You took X-ray, disc herniation, right? 1, 2, 3, 4, 5, right? 6, 7. Do neurologist test, muscle test, and then do acupuncture in that area. Hell, what is this? I did it? Really? That's what I thought. Right after I graduate, I didn't know what should I have to do. But I think if you ask me what should I have to do after, before I graduate, I can tell you, if you wanted to do acupuncture, 5 elementary theory is very important. Learn pulse diagnosis first. Herbal medicine, ashwagandha, ginseng, ginger is very important too. But each herbs go to each muscle tone. So they have a lot of chronic protract muscle spasm. They call Teiju. Is it jujube? Did you ever hear about jujube? Jujube always go in here. But jujube has a sweet taste. Jujube always tonify their kidney. The spleen. But if they have too much jujube, the blood sugar can going up. So diabetes patients has to be careful. So each muscle tone is relating it with each herbs. So that is another, the story too. So email address, I will send it when I have that little good story. Okay, very nice to meet you. So I hope you all eagle. Okay, you know what that means, eagle? Eagle means $1 million every year. All right, yeah, why not? Thank you very much. Thank you.